on the actual CDC website, it reads, spread from touching surfaces is not thought to be a common way the virus is transmitted. And where this came from was there's a lot of research going on, and we have to remember that the coronavirus, it's something new, and we're learning every day. Our scientists are working day and night so that we can help people become safer. And what they're determining is the virus can maintain itself on surfaces for hours, days, even weeks. There was a study in Australia that showed it can remain on a surface for up to 28 days. Wow. And that can bring about quite a bit of fear. But what they're also discovering is the amount of virus on the surface in most cases is going to be less concentrated. And this low concentration of virus on a surface, well, it's typically not enough to penetrate the mucous membranes, infect the cells, and cause the person to become infected with COVID-19. So it all depends on the different scenarios, but the good news is it's less likely to transmit from surfaces, especially within your own home.
But probably we still need to keep things wiped down just about like we have been doing then.
Well, we do, but at the same time, what we're hoping is people will understand more about the virus, and that's what the scientists and the doctors and researchers are trying to convey to the public so that they can understand that coronavirus transmission involves risk scenarios. For instance, let's say you're in a busy restroom in an airport right next to a lounge, and a lot of different people are going through that restroom, touching the handles, touching the faucets, touching all the different parts in that restroom. Well, that's a time that there's a higher risk of transmission from surface touching because there's going to be a higher concentration typically. But then there's a scenario where you're in your own home and maybe you haven't left the home all weekend. There have been scenarios where people have reported that they wipe down their counters every hour on the hour. There's such a low risk in that scenario. There may not be such a need for so much, and hopefully this can decrease some anxiety that a lot of people are suffering from right now.
You mentioned anxiety. We've got about a minute left, but I want to touch on this, or you to touch on it anyway. You're prescribing more anti-anxiety medications because of people who are getting kind of uptight during the COVID pandemic. Is this something that people, do they need to go to their doctors about it? Should they be not reluctant to go to their doctor, I guess is what I'm trying to say.
Oh, most definitely. I mean, right now is a very hard time for a lot of people. There's a lot of anxiety, and we have to worry that anxiety can lead to a lot of consequences, such as suicide in some cases, exacerbating depression. But also understand that anxiety causes your immune system to be weakened, and in that case, you're even more vulnerable if you contract COVID-19. So it is a good idea to contact your doctor, and most doctors like myself, we're providing telemedicine so you can be treated in the safety of your own home, and we can go ahead and get you some type of treatment so we can get through this, but know that we are going to get through this.
Always good advice. Dr. Timothy Quinn, thank you for dropping in on us, and you have a good weekend, the rest of the weekend.
Yes, sir. Thank you.